So I wanted to ask a little bit about the mental health aspect for you of managing a chronic illness. And, with your diagnosis story, we talked about how there's different stages of acceptance. But have you experienced any mental health challenges like anxiety or depression as a result?
Yeah, absolutely.
Yeah.
And I really appreciate you asking because, big problem with people seeking help is the stigma associated with talking about mental health. And it's been a huge part of my RA journey, is both the physical management of my symptoms as well as what I liken it to more for me personally is grief, is the processing similar to any other sort of loss.
Right.
Because I had, at the time being diagnosed in my early 20s, I had a vision that I was, dead set on executing, and I had been, lining up all my necessary accomplishments to achieve said goal, and then just had it, I said before, the rug pulled out from under me.
Right, and your goal was to go to the Peace Corps and...
Right, and lead this, jet-setting international global lifestyle that just is no longer feasible. One, I don't have the energy. Two, but just the physical limitations that I could not hike for 2 days into the forest or be away from a refrigerator.
For your medications.
And
not for food, but also food.
But yes, also food. Always also food. But also being immunocompromised in compromising situations. So, I logically know all the reasons why that this cannot be, but that still doesn't make it sting any less.
Right.
But where I've come to now through significant professional help.
Yes.
That's the important part, I think, to say. I did not do this on my own. I have an incredible therapist.
So great.
I have been able to realize that how unhelpful it is for me to focus on what could have been that can no longer be, but think about what were the real outcomes I was trying to achieve with that vision and how I could still get to that end game differently. And so we talked about this earlier, but in my choice of career in focusing on nonprofit administration, I'm still saving the world from behind a desk. And that's, okay, and can be more than okay, can be amazing. Just look at, we're here in Seattle, look at Bill and Melinda Gates, right? They sat behind desks and changed the world. And, that's part of my process has been working through that. The grief still comes up. It's not like it's totally gone. I'm faced with it any time. My husband, for example, is incredibly energetic and physically active, which I've mentioned, and he will want to try a new sport. Guess I'm sitting in the car, I am an expert ski lodge bunny, though, by the way.
Which is where you use for those of you in hotter climates. Can you explain what that means?
A lodge bunny, yes. My husband likes to downhill ski. I have tried. It's really not great for my knees. It does involve a lot of bending of your knees, and for an extended period of time, I can't really do that. So I just wear really cute parkas and sit in the ski lodge and knit.
And drink hot chocolate.
Yeah.
Yeah, I know. That's, for me too, my whole identity before I was an athlete, and so I was so hardcore. I ran, I lifted weights, I was so active, and so, I definitely get hit by those waves of grief when I see how other people are doing the things that I imagined that I would do. But like you said, there's ways to channel that same, to some degree, there's ways to channel that same energy into other activities, but there also sometimes is benefit to just saying, you know what, that's not in the cards for me, and focusing on accepting that versus continuing to kind of chase after that, for me at least. but you mentioned you have professional help. Did you have a hard time finding someone, or how did you find the therapist?
She was the second person I went to, so it definitely wasn't a one and done shot. The first therapist I found locally, I wanted to leave halfway through, and honestly, I should have.
I mean, I think on average they say and like I was planning on seeing 3 to kind of figure out which one, and then the first one I got super lucky. She's just the best. And I'm like, you're never allowed to move, and if you do, I'm going to use teletherapy so you can still see me.
I mean, and the internet is a beautiful thing. There's patient reviews. I mean, and even I found actually, because there's a self-selection bias for the folks who reply to reviews, of course, so you're going to get a lot of
the bimodal, like the best, worst.
So you take all that with a grain of salt. So I like to look at just what the provider is saying about themselves. You can learn a lot about them and the way that they speak about the care that they provide to increase your chances of finding a better fit, rather than just like throwing a dart at a board and to pick who you're going to see. So I got pretty lucky finding someone pretty quickly, and it's really great. She's fantastic.
What advice do you have for people who might be newly diagnosed with rheumatoid arthritis? People who are like, what do I do? What does this mean?
Yeah. Well, I think, what do I do? What does it mean? Those are exactly the right questions, actually. I would say, keep asking questions. Take an active role in your care.
Yes.
Don't be afraid to get second opinions. Don't be afraid to ask for more information from your provider. And don't be afraid to push back. Wait, what do you mean when you say things are going to look different? That's a generality. What will look different? Because
I feel like I wish I could go back in time and listen to when my provider told me about my diagnosis. I feel like I had been suffering for a couple years before I got my diagnosis, and I knew something was wrong, and I had been told by multiple specialists, you're just anxious, you're type A, you need to relax, you need to stop. And I was like, literally the only thing I'm type A about right now is that I want someone to help me figure out my body, like what's wrong with it. And so I felt such intense validation when she gave me my diagnosis. I feel like anything else she said, I was like, murr, 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 murr. I was like, what I got from the conversation was, you were right. You have a specific diagnosis. And I wanted to know, is there something you can do about it, right? And yes, there's medication for it. I'm like, anything else she said, I was like, I'm validated. I was right, and I have hope now, right? Because my symptoms fall into a medical category that then I could have addressed. But so I think one of the hard things for providers is if you're newly diagnosed, you may be so desperate for like immediate relief that you're not even potentially receptive to like this more larger set of patient education that really has to happen at some point, though. Is like, okay, you may right now all you care about is getting your pain from like a 9 to a 6, but you need to be educated on the fact that this is going to affect your family planning. This is going to affect your estate planning in terms of like long-term care when you become elderly. It seems like forever in the future now if you're a young person with RA, but these are all things you need to think about. So anyway, long story short, that's something that I try to figure out. When's the right time, like, to disseminate all the information a new patient needs, right? Maybe not in the first appointment, but you also can't wait forever, right? So it's hard.
That's so important. That's never been discussed with me, even actually.
No.
The long term. It's always
get to the next 3
here
months
and now. Get to your next checkup.